Good morning, everyone. First of all, I would like to thank the possibility of being here. It was a very interesting case to discuss. And also apologize for not being physically with you. I had a personal issue that had me return to Lisbon. Right now, what I'll be doing is presenting on an ethical and legal issues of the case we just listened. And I'll be sharing with you my slides. I hope you can see them. So first, I think this case raises a lot of ethical issues and a lot of legal issues. And first of all, I think it's clear for everyone it has to do with consent and autonomy, because there was a medication that was discontinued and then another one initiated without formal consent, which leads us to raise concerns about the patient's autonomy and the right to participate in his care. More specifically, the risk of involuntary medication change is taking place in prisons. And definitely, this medication for ADHD was interrupted without his consent. And the right of treatment, because there were a lot of psychiatric symptoms we listened and that warranted treatment, but it was considered malingering. So the skepticism that did undermine the rights for the person to receive the medical treatment. The range of autonomy within institutional constraints is a more general issue that is also, I think, raised here. So how can we maintain individual autonomy? Should a patient stop also deciding whether he should eat soup or if he should eat fish? What's the range of institutional constraints we can apply to a patient, particularly a patient with mental illnesses? Another issue I think is very clear here is the issue of misdiagnosis and mismanagement. So the fact that within the system, we just saw a misdiagnosis, and that has a big impact because the patient cannot protect or search for other types of care. So he's obliged to continue on under the care of the person who hasn't diagnosed him for what he has. And also the impossibility of a coordination and continuity of care. He left the outpatient services when he was admitted. The care was fragmented, and we've seen a poor coordination between the hospital, psychiatric services, and personnel. And lastly, I think you need to raise also the thing about systemic policies, because the prison's policies, for instance, requiring drug-free tests and the rules could compromise individual care quality for psychiatric patients. The standards of prison healthcare are also at stake here because there's a fluctuating quality of psychiatric care, which is a challenge for most healthcare systems, but particularly for healthcare systems within prison systems. I've been an expert supervising reviews of psychiatric care in Portugal prison systems. So I've visited a lot of prisons. And so this case raised this awareness that for me was very clear, that there are systemic issues in prison healthcare that lower the standards of treatment. First of all is the access to medication. Certain psychiatric medications upon entering prison system need to be stopped. And that's a problem for patients with specific diagnoses to keep on having their treatment. There are many healthcare providers, because we can't forget that within a psychiatric ward, within a prison facility in a hospital prison, part of the providers of care, which are not usually healthcare providers, are not nurses or doctors, but prison guards or administrative personnel, should be trained and be experts in healthcare providing for psychiatric treatment, because they will fail to recognize and appropriately address symptoms. This is a problem for most of these facilities that I visited, but here also a problem. And there are systemic barriers also in terms of healthcare standards, because policies usually prioritize security and administrative procedures over immediate healthcare needs. And that's another problem. The rights of persons who are admitted to prisons are also at stake here, because they have the right, they have a lot of rights. And I think I just list them: the right to healthcare, the right to mental health treatment, the right to be treated with dignity and respect, and the right of continuity of care. These are main rights that most of healthcare are structured upon, but definitely limited in prison systems, because the community standards are usually not kept within the prison system. And there are many psychiatric issues which are not adequately addressed in the prison. We see a lot of cases, some of them mediatic, but this case also raises this problem. This is particularly true, the standards of healthcare for psychiatric patients, which see their treatment also limited in terms of ethical issues, because many of the symptoms they have could be considered to be forms of malingering, and it's difficult to respect patients' experiences interpreting their behavior within a carceral environment as psychiatric symptoms. So how can we recognize and validate symptoms? Because I think that we all must take all symptoms seriously and without prematurely dismissing them as something that's being faked or different just because they're in high stress prison environment. And we need to keep this perspective, which is centered in the patient, without managing and approaching healthcare crisis just as usual cases of malingering. Although the case raises no cultural consideration, I think it at least raises this individual consideration, which is linked with cultural considerations. So psychiatric care is sensitive to the individual cultural identity, and that needs to be very much addressed within the healthcare in prisons. And we need to raise also awareness to the patient's needs and how to advocate for them, because we know this double form of vulnerability of psychiatric patients which are admitted to a healthcare facility, because they are both vulnerable for the psychiatric disorder and they are vulnerable because they are admitted. So how can we ethically and responsibly how can we responsible healthcare providers in these settings? It's sometimes very hard. Lastly, I think the case raises awareness of the relations between mental health and criminal justice, which is a complex relation. As we know as psychiatrists, sometimes we have to admit patients to hospitals which have personality disorders, and sometimes there is this limit between the diagnosis of the personality disorder and the fact the patient could be committing a crime or just being disordered in his behavior, not because of severe mental disorder, but just because of his personality. And if that's the case, then sometimes the legal system should be at the better place to address these issues. Of course, with a psychologist and a psychiatrist to diagnose, but not in a mental health facility. But the opposite is true, and it's been studied, for instance, in countries where involuntary treatment was impossible, that the patients that are not admitted to mental health institutions, they end up being imprisoned. So the relation between mental health and criminal justice is complex. And I think the case underscores the need for a better integration in mental health providing and criminal justice systems. The policies and practices we now have a lot of implications. So we need to find protocols for medication management, psychiatric evaluation, and treatment continuity to address these issues. Lastly, I think resource allocation is a problem, at least in Portugal it is. So we have limited resources everywhere in our public healthcare system, but I think it's particularly true in prisons, and that affects the quality of mental health care. And lastly, sometimes we treat only acute crises in prisons. We don't intervene significantly as forms of preventing or early intervention for symptoms. So only severe cases are addressed. And that's also a problem and different from what it is the standards of care of today's psychiatric treatment. Thank you for listening. It was a pleasure speaking to you about this topic, and I hope you have an interesting discussion.